So in this tutorial, we're going to continue with caring in health. So we know the meaning of care, but we need to know there is a difference between health care and also caring in health. So one thing that we need to get to understand, due to the increased complex care for patients, like just taking care of patients is that complex. And because of lack of time as health practitioners, there is a risk that healthcare practice will become more technical without caring. So, healthcare practice becomes more just a job where you don't just care. That is true because you have got a lot of things to do, you have got a lot of things to look at, and you don't have enough time. So, you end up just considering your job. That is, you just consider the technical part and you stop even caring. So, what really are we saying? So, caring is seen as a relationship. When you're talking about caring in health, this is a relationship that you have. So, this is a relational, practical, and moral. Okay. That relationship that you have one on one with a patient. So, relationship in caring is understood as essential and requires at least two people, where one takes care of the other who suffers. So, caring in health is so different from healthcare, in that caring in health means there are two people where there is a relationship and there is also taking care of another. So, one person is taking care of the other. That is, what does taking care mean? So, this is looking at the needs of a person and also just getting to interact with them, being there also for them. So, moral in caring means to see and condemn the other in the light of his or her situation. Now, when you're talking about caring, this is where you get to just pay attention to these people. You take them as a human being. Just that feeling that you would have for a human being. This is the meaning of caring in health. Okay. Now, when you talk about healthcare just refers to the delivery of health services. So just delivery. Now, health services can talk about delivery of things like medicine, and how is it provided? Are you providing it efficiently? So just the efficiency of the delivery of the medicine, is it efficient? Apart from the efficiency, also is it equal? The delivery of these health services, is it equal? Is it equitable? And also, you get to look at the cost effective. Is it so costly? How costly is this medicine that you are giving? So healthcare giving of medicine, providing a delivery of healthcare services, but caring in health is having that personal one-to-one interaction with a patient. So these are two different concepts. So healthcare refers to the delivery of evidence-based medicine and how it is provided, whereas caring requires health professionals who focus on the relationship with the human being, not looking just at someone who is sick, but on the human being behind the sickness. So, what relationship do you have with the human being? And also, just by seeing, understanding, and being attentive, open, respectful, treating the patient as a person, and taking responsibility for their needs. So, that is caring. That is the difference between health caring and just caring in health. So, health care really not health caring, but health care is designed to address the needs of patients by creating an operational system to provide for such needs for the public in general. Just what are you able to do? That is more the many coexistence of even a clinic, the many coexistence of even a hospital. Just creating an operational system. Is the hospital operating? Are they delivering? That is what we call healthcare. Now, when you talk about caring, this must be always you get to ask yourself, how is the person feeling? If you get to enter into, yeah, you put yourself in the place of the feeling, or in the place of the patient. How are they feeling? How does it feel to be kept waiting? So even when it, of course, you are able to deliver medicines, but you think of it about on yourself. How does it feel to be kept waiting? How does it feel to be kept examined or drawn on? So you get to address the multitude of experiences that patients are asked to endure, or that patients are given a lot of times to stand. That is now caring. You take now it at a personal level. Healthcare is just getting to consider the things that you're supposed to do, giving medicine, and you forget, you leave. For this video, thank you so much for having been present. Stay blessed.